Hi, this is Suzanne Clegg of spiritgate.com with another one of my frequently asked questions in my octave resonance healing approach to cancer. I use energy medicine, hands-on healing, distance healing to stop pain, cool down tumors, extend life, bring comfort to life, and to help the whole family situation have it become a healing experience rather than just pummeling and diving into death kind of experience. Because something sort of magical happens when you realize that your own hands can really help your loved one, or doing an inner process inside yourself can cool down your own tumors, can clearly benefit your life quality, your quality of life, if you're the one with cancer, especially like with pets and things like that, and help training people how to do a very simple hands-on healing approach that they can do while they're petting their cat or their dog or their horse. It's just nice. All right, so this question is about what if I have had chemo or radiation? Does that mean the energy medicine won't work? And I used to be very cautious about taking on patients that had had chemo and radiation. And it wasn't that I was opposed to their doing the chemo and radiation. I mean, you're between a rock and a hard spot. You got to do something, right? I guess you don't have to, but most of us feel the urgency to try something. But it seems that when I would put my hands on somebody who had had chemo, even if the chemo had been quite some time ago, I got this little piddly response. The tumor didn't quite cool down, or it took like an hour and a half to cool it down instead of 10 minutes. And then afterwards, we weren't sure that anything was better. So it was, and I'd try sometimes giving like 20 treatments and not really sure if I was helping. But the patient's willing to try, so I'm willing to try. And, we're in clear communication about expectations and that. And for the longest time, I felt like that was a barrier that I couldn't get past. And then I got a patient, and she'd had full chemo and was 4th stage cancer, and she got better in 1 or 2 treatments, and clean PET scan, the whole big works. And I thought I learned so much from that. And I learned so much from my failures. I really... the people who pass on after we valiantly tried to really extend their life, it's like I memorize every little bit of what we tried, so that if I see that happening in another patient, I can, have a second go at encouraging them to tweak something, change something. And I think that I wouldn't call it a breakthrough, but I have helped enough people have clean PET scans after having, 2nd to 4th stage tumors, that I'm starting to get not just the energetic signature of the cancer, which I have easily, but the energetic signature of when it's actually shifting. And I'm always trying to amplify and improve on that. So I guess an answer like, will you respond if you've had chemo radiation? We can try. And I can let you know if I think that it's worth continuing or not. And you can tell me too. All right. So thanks for watching. I'll see you on the next question.